right. Well, we hear a lot about mammograms, and Sarah wants to know, should women get mammograms before 40, even if they don't have a history of breast cancer in the family? And can women get them before 40 if they want their own peace of mind?
So this is a really good question. And I think what's been lost in the mammogram discussion is the limitations of mammograms. So mammograms, first of all, are looking for cancers that are already there. So it depends on how likely it is a cancer is there. The second thing is, in young women, breast tissue is much more dense. Your breasts stick straight out, they don't droop, and what makes them stick straight out is the dense fibrous breast tissue. And so cancer on a mammogram is white, and the dense breast tissue on a mammogram is white. So it's like looking for a polar bear in the snow. You can't see it. Once you go through menopause, your breast tissue turns to fat, it gets droopier, but fat is gray, cancer is white, shows up great. So it's a much better tool in women over 50. The second thing is the risk of the radiation causing mutated cells is much higher in younger women. So if you get mammograms starting at age 30, it's cumulative. The risk of getting mutations, adds up. You probably will cause more cancers than you cure if you gave them to everybody. If you did them 40 to 50, it's about a wash. And after 50, you'll cure more than you cause. So it's not that we want to deprive young women of their God-given right to be radiated. It's that it's not a good tool in young women. And what we need is not to argue about it, but to get a good tool.
Right.
We need something that's going to work. Ultrasound, and there's getting to be some automated ultrasounds is a good tool for young women. For women who carry maybe the gene for breast cancer, MRI might be an option. And we're working here at the foundation on a home test for breast cancer. It's sort of like a pregnancy test. You put this thing on your nipple like a pasty, and then you massage your breast and squeeze your nipple. If you have any fluid, it gets collected in a little piece of filter paper, and then you would put it in and put a few drops of solution on it and just put a dipstick, and it'll turn, make a line just like in a pregnancy test for different markers. So we've tested it in China in 1,000 women, and we're now buffing it up, and then once we get it, so we're really happy with the markers, we'll test it in the Army of Women. We'll have everybody do it, once a year and send it in, and then we'll see who gets cancer and who doesn't get cancer and see if it really works. But that would be, that's the kind of thing we need for the young women. Not something that works in old women and, is sort of doesn't work as well in young women. We need new things, better things in the young women.
That's very exciting. That test is very exciting.
Now we have to do new things.
Sign me up.
We keep doing the same old stuff. It's time for some new ideas.
Yeah, absolutely.
Great. Well, speaking of breastfeeding and motherhood, Shelley wants to know, is it possible to breastfeed after being treated with radiation therapy?
And the answer is, it depends. So there's a couple of things that happen with breast surgery and radiation. With breast surgery, depending on where the lump is, you could cut the ducts between where the ducts that carry the milk to the nipple enter the nipple. They could be, or you could get scar tissue that blocks them. So when that happens, your breast will swell up with milk, but nothing will come out, and you aren't able to breastfeed from that breast. So that's one possibility. The second is that some people who get radiation can breastfeed, and others find that their breast said, no, I won't do it. So it's not where you can say absolutely you can't do it. And I always tell women it's worth a try. It's not going to cause any harm.
Okay.
And it's worth a try, and it just depends on where the lump was, what surgery you had, and how your breast responded to the radiation.
Great. Very interesting. Let's go back to Twitter for a minute. What is inflammatory breast cancer?
So this is a good question. This is a kind of breast cancer that shows up first as redness of the skin. There's no lump, and you can't see it on a mammogram. It's not very common. It's like 5% of all breast cancer. But it is fairly, and has been very aggressive. When I was young and just starting out, this was the one that always killed you. Now, luckily, we actually have much better tools, and we're doing much better on inflammatory breast cancer. But the reason it got its name is very often the woman will have redness and swelling and some tenderness in her breast, and it's like a mastitis or an infection. And so they treat it with antibiotics, and then if it doesn't get better, they really need to do a biopsy. And you can do a punch biopsy of the skin and make the diagnosis. If it gets better on antibiotics, then you don't have inflammatory breast cancer. And if you're not breastfeeding, you're less likely to have an infection, and you want to check that out. So not common, but can happen, and you can have a normal mammogram and have inflammatory, and you don't have a lump. The cells are right towards the skin and they're scattered about, and you usually treat it with chemotherapy first, and then sometimes radiation, and then maybe surgery as well. And women are doing much better now with inflammatory than in the past. And there's some evidence that it might be related to a virus. Either this is the really interesting thing. We don't know what causes breast cancer. We have no idea what causes breast cancer. And I wouldn't be surprised at all if it wasn't a virus.
Wow.
But, nobody's looked. Nobody has actually looked. We have another study we're about to do where we're going to look at what grows in breast fluid in healthy women. Because the doctors all think it's sterile, but any organ that has as much sucking on it as a breast is unlikely to be sterile, because the mouth isn't sterile.
Right, right.
So there probably are some bacteria and some viruses that just live in us, and we're happily, and some of them might not be so good. So we're going to start looking at that, because if we could find a virus, we could get a vaccine, we'd have an answer.
Just like HPV.
Just like HPV.
Yeah.
I mean, look at HPV. We've got a vaccine now, and then we're finding that HPV doesn't just cause cancer of the cervix, anal rectal, cancer in the anus, but also back of the throat. We're so sort of prudish here. We pretend there's no oral sex going on. But in fact, HPV cancers are happening in the mouth, back of the tongue, and the throat, and it's the same HPV that causes cancer of the cervix. So we have to get over our squeamishness and over our allergy to thinking that pretending that nobody's having any sex, and really vaccinate boys and girls.
Oh. HPV for boys?
For boys. Just came out. They're just recommending all boys get HPV vaccination as well, because they get cancers as well. They get anal cancers, and they get the throat. Sometimes get the mouth and the throat cancers. So yes, and then they would also, and they're the ones who give the girls the cancers. Right. Mm-hmm. So if we vaccinate both, and who knows, HPV could well be associated with other cancers as well. Yeah. I would not be surprised. I have a 23-year-old, and I wouldn't let her go to college without getting vaccinated. I
really
nagged her into that gynecologist's office, because you want to get vaccinated before you're sexually active. Then it works the best. And that's the reason why they're talking about doing it at middle school.
Yeah, really young ages.
Yeah, it's not because we want or we think our kids are going to be sexual, but it's because you don't know. And the last thing you want is to miss the opportunity. So I think what we really should do is just vaccinate everybody when they go into middle school. You don't even have to tell them it's about a sexally transmitted disease.
Right.
They don't even have to go there. Just say, these are the shots you have to have.
On,
Here's
exactly.
hepatitis, here's HPV, here's this. And then, then you don't have to worry about it.
Information is so powerful. So it's so important.
Yeah, and this research is so important.
Right.
Yes. So, Wendy wants to know, she says, my mom had breast cancer and my sister had ovarian cancer. They're both survivors. Is getting the BRCA test a good thing, or will it just make me crazy?
That's a good question. So there are two genes that are related to breast cancer, BRCA1 and BRCA2. And BRCA stands for breast cancer. Scientists are not very original. You think it's something really fancy. And I bet you if they find another gene, it will be BRCA3. And these genes are inherited from the mother or the father, can come down on either side. And they're associated with breast and ovarian cancer, particularly BRCA1. A lot of the ovarian cancer is related to BRCA1. And so in this situation, she probably is at risk. Now, she shouldn't be tested. Either her mother or her sister should be tested. Because you always want to test somebody who has cancer. Because if they don't have the gene, then there's no way they can pass it on to you. So she needs to ask one of them to be tested. It's a blood test. It's not, anything that fancy. They can do it. And then if they're positive, then she can be tested. She still only has a 50-50 chance of getting it. So it's very possible that her mother and sister could have the gene and she could not have it. But it's good to know, because if you carry the mutation, you have a 60 to 80% risk of getting breast cancer, which is a lot. And those women very often think about having either their breast removed preventatively or their ovaries or both. And removing the ovaries will reduce the risk of breast cancer by 70%, as well as reduce the risk of ovarian cancer. So, or if you found out you might want to have kids right away, and then have your ovaries out, it'll change the way you think about your life. So I think you'll be less crazy. But you want to have your mother or your sister get tested first.
Oh.
We were just talking about that.
Yeah, well, why? I don't know. I mean, my mother passed away over 20 years ago,
Yeah.
so I have no idea if she had the gene. So I guess it would be.
And you
up to
have
me.
no other relatives.
Oh, actually, my aunt, I guess.
And did she have breast cancer?
She had breast cancer as well.
So have her tested.
Yeah, okay.
Yeah,
I'll
no,
talk to
because
her.
it's going to be the same gene. So it's
Okay.
a blood test, and it's a blood test. So it's not like she has to do something really scary
Right,
or
right.
excited, and it probably could be covered by insurance. So yeah, it's always better if you can find somebody who's alive that has the cancer. It's better to test them, because then they know what mutation, if there is one, which one it is of a variety of them, and then when they test you, they can look for the specific mutation that you would be likely to have if you had it, as opposed to just sort of looking at everything. So it's much more accurate that way.
My mother
Good to
just
know.
asked me that question the other day. Would you like me to get tested for the gene?
Yeah. And
I
she's
said, I don't know.
is she the
Talk to
only
Dr.
one?
Love.
Is she the only one that has breast cancer in the family?
My grandmother on my father's side had breast cancer as well.
Okay, but that's not related to her. So
No, it's not related to
yeah.
her. Right.
So
She's the only one.
Okay. And so, she could do it, but it's not a compelling story for hereditary. Just having one first degree relative, like a mother or a sister, is often not enough. And the other thing is, if you test negative for the gene, that you don't have it, it doesn't mean there's no gene in a family.
Yeah.
It just means it's not one of the genes we know how to test for, And so people will say to me, gee, I have all this cancer in my family, and we tested, and I tested negative, how can this be? It's that they probably have BRCA6 or 7 or one that we haven't discovered yet. And we are recruiting in the Army of Women for several studies looking at this. The one I talked about in New York, but there's one in Washington that's looking at people who are diagnosed at a young age of breast cancer, and then they're mapping genes. And you can be old now, but as long as you were diagnosed when you were young, I think it's under 40, but I'm not sure. You have to look on the website. You would be eligible, and then again they map the DNA, and they're looking for some of these other genes that may well be related.
All right. Well, this is a question that I've been dying to ask as well, but Patty wants to know if you believe that there's a relationship between getting IVF and having breast cancer.
Good and
It's
timely
definitely,
question.
definitely in the
Exactly.
news.
Timely
yes.
question. So the answer is the studies that they've done have not shown an increased risk. But most of them are actually, because remember, you got to track people over time. So there are people who had IVF 10 or even 15, 20 years ago, and they tended to be young and infertile because it's only fairly recently, or they might not have even had IVF, but had fertility treatments and some of the same drugs. But it's only recently that we've started to use it as much as we have, and in older women. So one of the questions is, we talked earlier that being pregnant and breastfeeding increases your risk. So that's one. So it may be that rather than the IVF. It could be the IVF drugs, or it could be that you're having a late first pregnancy because of the IVF, and that makes you at higher risk. What you need for breast cancer are you need mutated cells, and they need to be in a local environment that's egging them on. So that's the fat and the fibrous tissue and all the rest of it. We think about cancer as if it comes from somewhere else, but really we grow it ourselves. It's not Osama bin Laden, it's Timothy McVeigh. It's our own homegrown terrorist. And it lives these cells live in an environment of other cells. And so things that change the breast, like pregnancy and breastfeeding and all that, can change the environment. Things like hormone replacement therapy also increase breast cancer by changing the environment. And lifestyle things can decrease, can be good for the local environment. Like exercise, decreases getting it, and recurrences.
Really?
So 3 times a week, break a sweat. Doesn't matter what you do. You can dance, run, do whatever, but you got to get your heart rate up. 3 times a week is probably the best thing you can do to prevent breast cancer.
Wow. That's great to know.
That's great to know.
And a good incentive
Yeah.
to get out there and do something. Yeah. So also on our Facebook, some of our Facebook fans had some questions. Is there any truth behind the Mirena IUD having anything to do with breast cancer? I've had people say that after getting the IUD, they got breast cancer.
Okay, I have seen no data to suggest that that gives you breast cancer. Now, the problem that happens when you just go, this is what we call anecdotal information, is that you know 3 people, they all had IUDs, and they all got breast cancer. You go, that's the cause. But what you don't know is there may be another 97,000 people who had it who didn't get it, and so they may be it may be that those same 3 people also all use the same hair color, or they all live in the same place and are exposed to the same thing, and so it's hard to tease out, and that's why you need big studies, and that's where in the Army of Women in the House study, where we're going to collect data, we'll have enough, and we can ask these kinds of questions, because the nice way we're doing this is you can tell us what questions you want to see asked in research, and we'll ask. We'll add it to our list. We'll add that IUD to the list, and we'll ask all the women in the Army of Women. Mm-hmm. We have 370,000 women right now. 70% of them do not have breast cancer. We want to have 1 million women. So if every one of you, not only do you need to sign up at armyofwomen.org, but you need to send it out to everybody, the one you send your jokes to. Send it to everybody in your mailing list. And so we can get there, because that's how we'll figure these things out.
Yeah, and Lifetime's partnering with the Army of Women. So every woman who signs up from our Lifetime Moms homepage, Lifetime will donate $1 for each recruit, so up to $25,000. So go there.
Added
Do
incentive.
it. Do it.